Metastatic bone lesions, those that arise from other tissue tumors, occur most often in the older age population and account for most bone cancers. While osteoporosis is the biggest risk factor for hip fractures, pathological fractures caused by metastatic bone are a major concern in patient care management because the most commonly affected areas for fracture are the acetabulum and the proximal femur. With osteoporosis, the disease weakens the upper femur, which eventually fractures and then causes the patient to fall when bearing weight. Many patients perceive their hip fracture to be a result of their fall, when in fact oftentimes their fall was likely caused by the existing fracture of the weakened bone. Whether caused by bone cancer, osteoporosis, drug therapy, or environmental hazards such as loose carpeting, inadequate lighting, uneven steps or pavement, or even pets that get underfoot, hip fracture is the most common injury in older adults and is one of the most commonly seen injuries in any healthcare setting. The patient today is an 80-year-old female who was brought in by ambulance complaining of left hip pain. She's had a history of osteoporosis, previous breast cancer, and right mastectomy. She's been newly diagnosed with bone cancer. We see her today on the med-surg floor with a nurse doing an assessment.
10 critical behaviors prior to every procedure. Check the physician's order. Wash hands before and after the procedure. Assemble equipment. Identify your client by checking the ID band and/or chart picture, and ask the patient to state his or her name along with date of birth. Introduce yourself to the patient. Provide for privacy and HIPAA confidentiality. Explain the procedure to the patient using developmentally appropriate language and technique. Be sensitive to cultural differences. Use standard precautions at all times. Use proper body mechanics at all times. Refer to the textbook and skills checklist for the steps of the skill you are performing, maintaining safety considerations at all times. Report your abnormal findings to your instructor and the primary nurse assigned to the patient. Document the procedure and the patient's response.
Good morning, Ms. Nelson. How are you feeling?
I'm in a little bit of pain.
Okay, can you go ahead and rate that pain on a scale of 1 to 10, 10 being the worst pain ever?
It's a 9.5.
Okay. And since we gave you that morphine about an hour ago, do you feel like the pain has come down from what it was?
I went from a 12 to 9.5.
Okay, good. Good, making some progress. Okay, I'm just going to go ahead and do a focused physical assessment on Mrs. Nelson, primarily paying attention to the affected limb. We're going to go ahead and check pulses and see if I feel any deformities or whatnot. And I do see that your pulse ox has come up since we put you on the oxygen, so that's always a plus. No trouble breathing?
No.
Okay. I'm going to go ahead and pull these down. Okay. All right, Miss Nelson, you're going to feel me pushing on both of your hips, and I just want you to let me know if you feel any pain. Go ahead and let me know when I do push, okay? So I'm going to push down on both your hips. Okay, you feel the pain on the left side. All right, I'm going to try to be gentle, just pushing. The reason I'm doing this is just to see, basically compare both your hips and see if I feel the same thing. So and I do feel a gross deformity on her left hip. So, all right, we're going to go ahead and just do your leg. Do you have any pain when I push? No? Okay. Now, how did you trip and fall? That's what the paramedics told me.
I've been having pain, but I fell walking my dog.
Okay. I'm going to go ahead and check for pedal pulses. How long were you having that pain before you
It's been about a week.
Okay. All right, so she has positive pedal pulses on both extremities. I'm going to go ahead. Miss Nelson, can you feel me touching the bottom of your foot?
Yes.
Okay. Are you able to wiggle toes on both of your feet? Okay, so I do see that she has limited motor ability on the left foot. She's not able to wiggle her toes as much. Go ahead and just push down gently like it's a gas pedal. Don't go hard though. Okay, and do you feel pain when you push down?
Or just the pain is in my hip.
Okay. All right, so the reason we're doing that is just to test her motor sensory abilities, because if she does have a hip fracture, there's a chance that there was nerve involvement. So we want to go ahead and get a baseline on that. I'm going to cover you back up. Okay. I'm going to go ahead and see what we can do about that pain. I know you did just last get your morphine 1 hour ago, and I know you're on your way to x-ray right now so they can get a definitive look. We'll have confirmation hopefully in about half an hour whether you have a fracture or not. Is there anything else I can get you?
No, thank you.
Okay. Okay, so before Ms. Nelson goes down to x-ray, we want to go ahead and get another set of vital signs, make sure that they're all stable. We do want to address her pain because they will be moving her around for the x-ray, so we do want to make sure that's under control. And we would go ahead and double check the labs and make sure everything's good there, address any issues if need be.
An older adult with a hip fracture prior to a fall may not present with the obvious signs and symptoms as one who had experienced a fall. Without the fall, the patient may report growing pain or pain behind the knee of the affected side. Some may report no pain, but are simply unable to bear weight or stand. Hip fractures are diagnosed by x-ray. A fracture in the area of the femoral neck is classified as intracapsular and is a common site for fracture in elders, especially in older women. This type of fracture involves decreased blood supply to the head of the femur, which can lead to bone tissue necrosis and result in pain and decreased mobility. A hemiarthroplasty is performed where the head and the neck of the femur are surgically removed and replaced with prosthesis. The client uses a walker and is weight-bearing soon after surgery. If the fracture is extracapsular, involving the intertrochanteric region, the fracture is repaired with nail, plate, and screws, with no disruption of the joint capsule, so there's no risk of femoral head dislocation, as there is with intracapsular repair. However, extracapsular repair site must completely heal, so total weight bearing is usually delayed, resulting in longer immobility. Post-surgical care of the hip fracture repair client includes proper body positioning of the client to prevent joint dislocation, turning the client every 2 hours unless otherwise indicated by the surgeon, and encouraging deep breathing, foot pumps, and ankle rotations. Strengthening exercises prescribed by the physical therapist should be performed throughout the day. The PT also generally assists with the first out-of-bed ambulation, but the post-op patient will need continued nursing assistance with ambulation and avoiding a dislocation. Finally, consult with the occupational therapist for adaptive devices, such as reachers and toilet seat extenders. Discuss home safety adaptations that the client may need, such as a shower or tub chair, and instruct the client to avoid wearing shoes with laces that must be tied. While the treatment of choice for a hip fracture is surgical repair, which generally has good prognosis for post-surgery ambulation, sometimes the patient will be so debilitated that surgery just isn't an option. In that case, traction, pain management, and bed rest to allow for natural fracture healing is the treatment option. With the patient in traction, the nurse needs to be sure the patient's heels are off the bed and that the heels and other high bony areas are inspected at least once every shift. In older adults especially, hip fractures have a high mortality rate as a result of prolonged immobility. Nursing interventions such as position changes, range of motion exercises, deep breathing, and coughing need to be implemented to help prevent pressure ulcers, DVTs, and alveoli collapse. The nurse should be vigilant in assessing for breath sounds and signs of infection, as pneumonia is prevalent in elderly immobile hip fracture clients. Constipation and fecal impaction as a result of immobility should be prevented by encouraging fluids, good nutrition, and stool softeners or laxatives if prescribed. Correct body alignment can be maintained with footboards and trochanter rolls. Many patients recover fully from hip fracture surgical repair and regain their functional ability. However, some patients, as is the case with our patient we saw earlier in the assessment, are not able to return to their pre-fracture activities of daily living and mobility level. These patients generally do not return to their homes and are placed in long-term care facilities. What is the significance of bone cancer as it applies to hip fractures? Answer: metastatic bone is weak and leads to pathological fractures, most commonly the acetabulum and the proximal femur, the areas for intercapsular and extracapsular hip fractures. True or false? Following any hip repair surgery, the client must not bear weight so as to avoid a post-op hip dislocation. Answer: false. The intercapsular repair post-op client is at risk for hip dislocation, but generally begins weight-bearing soon after surgery under the supervision of a physical therapist. Weight-bearing is usually delayed in the extracapsular repair post-op client so that the site may completely heal, not because of hip dislocation risk. A patient has elected not to have surgery. Which of the following is a primary nursing consideration for this client? Answer D. Deep breathing and coughing regularly encouraged. A. Bed rest, not ambulation, is the key to naturally healing a fracture if surgery is not the option. B. Body positioning and turning are important nursing considerations, but not the priority intervention. C. Prevention measures should occur before constipation becomes an issue. Relief from constipation, should it arise, is an important nursing consideration, but not the priority intervention. D is correct because pneumonia is so common in elderly immobile patients. It is one of the greatest contributing factors to the mortality rate of hip fractures. Deep breathing and coughing exercises help prevent infection and improve oxygenation.
She's now been moved to the med-surg floor where we will watch and observe.
Tissue tumors occur most often in the older
Fracture. How you doing?
No, wait, hold on. What are we doing now?
which generally has a good prognosis for post-surgery ambulation. The nurse should be vigilant.
I imagine
Often occur most often in the leukemia for rest.
No, wait.
Such as position changes.
And I'm Shauna, and I played the role of the registered nurse.
Turning the client every 2 with mobile